Yeah, no come look at the just so I say that you find me. For a long time, I'm silent. I don't wanna, I'm studying, but the things say I'm hiding, cause I don't know how to find me. I'll be on no Zumba, I'll be on
in the People's Paradise, it's Unico Radio International. Cross River Estates, Nigeria, 103.5 FM. Education, information and entertainment.
The Unical Chapel of Redemption, University of Calabar, is delighted to
You are now tuned in to your number one radio station.
Unical Radio International, where education rocks. Prepare to be entertained, enlightened, and educated. Get ready to embark on an unforgettable radio experience. Unical Radio International, your ultimate destination for audio infotainment.
The Association of Radiographers of Nigeria, Cross River State Chapter, proudly invites the university community, staff, students, and the general public to celebrate the World Radiography Day 2024. This year's theme, Promoting the Profession, is both timely and significant, underscoring the importance of advancing radiography. This event presents an opportunity to showcase advancements in the field of radiography, discussions on new techniques, and the critical role radiographers play in assuring quality patient care. Date, Friday, 8th November 2024. Time, 12 p.m. prompt. Venue, Dr. Franklin Ane Auditorium, College of Health Technology, Calabar, Cross River State. We warmly welcome you to join us in this momentous celebration and learn more about the radiography profession's vital role in healthcare. This announcement is signed by Mr. Oyama Abeng, Chairman, Association of Radiographers of Nigeria, Cross River State Chapter. See you there.
We have come from near and far to unite in Calabar. We'll work to build a alma mater, University of Calabar. I've got that lightning inside me, son of a god. I'm like a titan that's
Thank you so much for staying tuned. This is still Unico Radio International 103.5 FM. That station that offers you information, education, and of course entertainment 360.
This is how
Time check is 11 minutes gone past the hour of 9 o'clock. My name is Michelle Idomasis, and as you already know, we already informed you during the breakfast show that we have amazing guests coming to the studio this morning. Because you know why? It is World Radiography Day 2024. Yesterday being November 8th is World Radiography Day. And so the World Radiography Day 2024 is an annual observance that celebrates the vital role of radiographers and radiologic technologists in healthcare and medicine. And so a little history about today is that the day was chosen to honor the discovery of X-rays by German physics professor Wilhelm Conrad Roentgen on November 8, 1895. And so Roentgen's discovery revolutionized medicine, providing a way to see inside the human body without surgery. So I'll be having a question and answer conversation or session with some amazing guests who are right here in the studio with me this morning. So join me as I welcome our beautiful guest. Good morning, distinguished guest in the house. Good morning, it's a pleasure to be with you. And happy World Radiography Day.
Thank you.
Okay, so I would love you to introduce yourself. So please let me start with the lady, the only lady amongst the men this morning, right now. So good morning, Ma.
Good morning. Pleasure to be here. I'm Dr. Ekaete Vincent Ukpong, senior lecturer in Department of Radiography, University of Calabar.
It's a pleasure to have you. Okay, let me go to you, sir, please.
All right, it's a pleasure to be here. My name is Oyama, the current chairman of the PRM, Kosovo State Council. It's a pleasure.
Awesome. It's a pleasure to have you here too. And please.
Good morning. My name is Ephraim Usani. I'm a radiographer.
It's a pleasure to have you as well. Please.
Good morning. My name is Adason Leo Samuel. The president of
Awesome. So I hope you guys are ready to, learn something new because I am about to be wowed this morning. So straight up, before we get into the conversation of the day, come on, thank God it's Friday. Abi? So at least besides being radiographers, what are those things you would love to do, to unwind during the weekend? I'd love to hear from you. So let me start with so please, start Abeng.
Well, thank God it's Friday.
Yes.
And it's likely that at the end of the day, we would like to relax our lives. Going out, relax, take some pleasure time to actually enjoy the weekend.
Sure.
Yes, that's what we can do for now.
Okay. So please, Mrs. Ukpong, what would you like to do to unwind on Friday?
I just like to go out, just walk around, go shopping, window shopping.
Oh, awesome.
Most time in the spa or near I just walk around and that's my way of relaxing. So
Yeah. I also heard it's therapeutic.
Yeah.
Okay. So also to Ephraim Usani, what would you like to do to unwind on weekends?
being an introvert.
Okay, so are you trying to say you are an introvert? Listen, it's nice to meet you as well.
Yeah. But I think I'm more of an ambivert now, but usually in the week, during the weekends, I usually go to work.
Just relax, just being a furniture. That's not nice one. Okay, and over to you, please.
During the weekend, I usually eat.
Okay, so you love to exercise. Just exercise. No strenuous ones. Okay, it's quite good. At least we all have a thing or two to, work will not allow us to do anything. But anyways, it's all good. It's all working fun. So awesome. So moving to the big deal of the day. What inspired the team? And this is to Mr. Abeng Oyama. What inspired the team for this year's celebration promoting the profession?
Thank you very much, Michelle. As a profession, there are some things we put in place. In a day like this, Radiography Day, we have been inspired. It's a global celebration of this very special day. Now, let me draw your attention a little bit to sometimes in the company, when the company is trying to carry out any promotion for a kind of products, they tend to bring out their innovations. They tend to bring out, show themselves in a manner, in a package, in such a manner that everybody will like it. So that is also could be applied in our profession today. See, there are a lot of things that must have inspired us, especially on this day. It's what is called global solidarity. We are making this to be in line with the global standard. Today, all over the world, the radiographers are celebrating this day. It's a bet into our profession. Another thing is with advocacy for the provision. You know, you need to enlighten, you need to showcase what you are into. There are also innovations too. You know, in this technological advancement, we need to tell the medical field, the healthcare, that look, this is what we are into, and we need to offer this. One thing I know is that change is constant, is the only constant thing is in life. So we need to be dynamic. With the advent of the innovations in terms of modality, we need to as well move alongside. So these are some of those things that must have inspired us as a profession to really showcase this view as we were reading that.
Awesome, awesome. Okay, thank you so much, Mr. Abeng Oyama. So moving forward to Dr. Ekaete Vincent. For those unfamiliar, can you explain what radiography entails and its importance to healthcare?
Thank you very much. I want to just start with a story. When I came into school and I was told to do radiography, some people thought I was in the radio station. I'm going to start doing it. Some people thought, and then my mother did not like it because people came and they were just telling them, had some story that radiation causes people to be sterile. You know, and as I came in, I saw that they are different. Radiography is the use of ionizing radiation and other technologies, not only ionizing radiation to view the internal organs for treatment or diagnosis. You know, like the MRI and the CT scan, MRI and the ultrasound, they are not ionizing radiation. It's only the CT scans, the conventional radiography that use ionizing radiation. So we use non-ionizing radiation and then ionizing radiation to view the internal organs for treatment and for diagnosis. That's just what it is. It's not radio. Radio means radiation. So it's not the radio station that we are. Radiation. The use of radiation to view the internal structure for diagnosis and treatment.
Awesome, awesome. Though the terms are massive, I know people like me out there might not even understand what an MRI is, but don't worry, just keep it locked. Don't worry, what I'm trying to tell them, don't worry, keep it locked because you're here to learn and you learn you well. So, how do radiographers contribute to ensuring quality patients, Mr. Ephraim Usani?
You know, there's a popular saying among the radiography sector, among the medical sector, that radiography is right? And that would mean that medicine will decline that. And now once many patients come to the patient, first thing is actually the patient actually what's really happening inside. I mean, because our eyes can't see inside of the human body. And so that's where we come in. We feel able of the human body. That is able to help the radiologist or the doctor or the referring clinician. So our role is very crucial. It's like it's vital. And without it, I mean, we can't even have quality health care patients. So we are the center of it. Remove radiography.
I totally agree with you because, to be sincere, treatments would have been really difficult. Just imagine maybe without radiographers and you have a problem, say in your spine or your bone, you will have to carry out a surgery first to be able to discover that problem before you now start doing the treatment proper. Already you have pains, you know, you're trying to heal from. But yes, thanks and big ups to all the radiographers, both in the house and outside and worldwide. Okay, moving forward. Radiography has seen many technological advancements, and this question is to you, Senator Adason Leo Samuel. Could you highlight some of the most significant innovations in recent years?
Thank you very much. Radiography is still one of the fastest developing professions in the world, from the first X-ray by the German physicist to now. The advancement has been very, very tremendous. Modern innovations now, we have things like digital radiography, where the long process of exposing a patient and waiting minutes to hours to get images has been totally eradicated. Now, under few minutes, you can actually expose a patient and have a diagnostic acceptable image that can be used to treat that patient. We also have instances now where, with the recent advancements in AI technology, AI is actually now being used in the profession to foster better images to assist in more diagnostic and acceptable images that can be used for also further treatment. These advancements actually help in reducing tremendously high doses of radiation to patients. The time is reduced tremendously from hours, days during the peak times. So now that you can have images under minutes and seconds. And we also, the quality of healthcare is also improved, and the workload is also tremendously improved. You can now attend to as many patients under a few minutes compared to when you can actually attend to just one or two. So these are the modern advancements and developments in the profession.
Awesome. And we are also hoping that there will be more advancements as we keep growing and as technology is, improving. Right.
Yeah.
Awesome. Thank you so much. Okay, still on advancements. How are these advancements improving diagnostics accuracy and patient outcomes? Mr. Ephraim, please.
Like to vivid message. Getting the image very good. And then he also mentioned AI. I am an AI enthusiast. The future there is already, we already have AI actually, and so we see faster healthcare right? So things patients so using of the release of that I think we can spend these are virtual reality that we have 3D. And so when we do professionals, when we do activities and what is called 3D, that means let's say we're looking at something anybody can appreciate. And outside of that, we can now do when you do it, able to look at the organ as it is in the human body, and that can also help with control and planning and also where radiography is heading to holds no bounds, and we are very excited to see where radiography will go to.
Okay, awesome. So, many people these days see AI as a big competition or something that's about to take their job. But radiographers, I'm not seeing that picture.
Okay, let me explain that. One thing it sets in is that AI cannot even take the place of radiographer, because when the patient comes, you need someone to position the patient. And when it comes to robotics, because that's only robotics that can actually take a patient. I mean, AI is not there yet. At least I've been around, it's not there yet. And so when it comes to human interaction, you need human interaction, right? So, and that's what we do. The patient comes, we see the patient, we track the patient, we position the patient. And I've not seen that happening in recent times. But when it comes to interpretation of results, people are scared. Will they take the role of the radiologist? No, it's supposed to be a tool that aids, right? Just like people use ChatGPT to aid their writing. It's not like it's going to do everything, right? So it's just a tool. It's just a tool that aids in diagnosis, just making things faster, right? Okay, so no fear.
No fear.
Yeah.
I like the confidence. I like the confidence. Okay. Thank you really, really so much. Okay, over to you, Mr. Abeng. Are there any specific new techniques or technologies being showcased at this year's event?
Beautiful. To come from where the last speaker has just said, we have talked about several things like AI. That is one of those specific area that is really making this the exciting, because with the advent of AI, a lot of things in our profession has been brought into a very simpler way that it enables us to be very, very active in our profession. That is one area. The other aspect is the advent of these mobile modalities. You know, you can stay at home and, Michelle, I assure you, if you want to do a kind of ultrasound in any of your abdominal, probably body part or whatever, you can give me a call. Mr. Oyama, please, can you come over? I can't make it to the hospital.
Oh,
so I can just conveniently take up my mobile ultrasound, come to your house, have a scan done with you without necessarily going to the hospital. Yes. Another area that this is making the atmosphere or this day exciting is the area of teleradiography or teleradiology. See, sometimes with the bulk of work in the activity in the hospital, patients' input is high. And if you have just one or three radiologists who are there to do the interpretation, it makes the work very, very difficult. What we do is, you sit at home, do these reports. It's a kind of, it's a computer system. It's an IT process that you stay at home, do your report analysis without necessarily coming to the hospital. And the reports, it's a link with 2 or 3 radiologists. In just probably a few minutes, the reports are ready. It makes the work very, very okay. I mentioned about 3D printing. To the public, so the profession, we understand what 3D printing is all about. We know you can image an organ or a structure. Definitely you can just look at it and say, okay, I'm seeing this in one plane. I'm saying I just need to see further a kind of looking at it in the other direction. Now the 3D printing is what we are able to bring out from the machine. After scanning a patient, you look at it in which plane this and this. This will give you a total submission of what you are looking for, and of course, it gives a guide to the surgeon. If he's going to do any surgery, this is the extent that I can go in this plane. This is the extent I can go. It gives us a kind of insight and makes the work of the physician very, very simple. These are the advents. These things makes this day exciting. These are the advancement that has been in place that is making us to say we need to promote this profession so that the world, everybody, the public will definitely know what we are into.
And with a smile on Mr. Oyama's face, you can see that it is something that you're so proud of doing. And like I still say, I am super happy that Today is World Radiographers Day because without these people, my darling, you and I would have been going to the surgical rooms back to back just to discover one pain or just to discover one problem or the other. So thank you so much, Mr. Ayambel. You're still on to Unico Radio International 103.5 FM. Today is World Radiography Day, and yes, we have radiographers in the building. They're here giving us amazing insights into this profession. We'll be going on a very short break, and when we come back, do not forget that these amazing guests are coming back to give you more details concerning this particular day. So do not touch that dial. We will be right back.
This is how legends are made. I've got that lightning. Need
The Association of Radiographers of Nigeria, Cross River State Chapter, proudly invites the university community, staff, students, and the general public to celebrate the World Radiography Day 2024. This year's theme, Promoting the Profession, is both timely and significant, underscoring the importance of advancing radiography. This event presents an opportunity to showcase advancements in the field of radiography, discussions on new techniques, and the critical role radiographers play in ensuring quality patient care. Date, Friday, 8 November 2024. Time, 12 p.m. prompt. Venue, Dr. Franklin Anie Auditorium, College of Health Technology, Calabar, Cross River State. We warmly welcome you to join us in this momentous celebration and learn more about the radiography profession's vital role in healthcare. This announcement is signed by Mr. Oyama Abeng, Chairman, Association of Radiographers of Nigeria, Cross River State Chapter. See you there.
We have come from near and far to unite in Calabar. We'll work to build the alma mater, University of Calabar.
For the very best in music, information, entertainment, and education, stay locked onto Unicool Radio International, 103.5 FM, Calabar, Cross River State, South Nigeria.
And inside me, son of a god, I'm like a titan that's rising. Oh, just you watch. I'm stepping into fame. There is no time to waste. I've got that lightning inside me. This is how legends are made. This is how legends are made.
You're still on to Unico Radio 103.5 FM, and it's World Radiography Day. I told you to keep it locked with us because we still have the amazing guests, our distinguished guests, the super amazing radiographers in the house. Please join me as I celebrate these people because it is not easy. It is not easy with all the work they put together just to make sure that, healthcare seems so seamless and stressless. Is it possible? Yes, stressless. Because, come on, without these people, my darling friends, patients out there, it would have been a whole lot. But thank you so much for keeping it locked. Time track is 37 minutes gone past the hour of 9 o'clock. And yes, we're still on to Unicorn Radio, still in the answer and question session right here. So yes, before we went on that break, Mr. Oyama was giving us some really detailed explanation how technology has actually helped in the advancement of this profession, and that is absolutely amazing. So coming back right now, we want to we're starting with you, Dr. Mrs. Ekaete. What steps are being taken to promote radiography as a career choice, especially among students?
Oh, thank you. Now the awareness is high Most times we go to schools to speak to those students from SS2, SS1. I remember when we were in school, we didn't know that we were just 11, 18, sometimes 5, and all that. People did not really know what it is. But now, when we're in school, and like what we are doing now, all Radiography Day, we make sure that people are aware of what we do. And then for the career, we need to make them to know what courses that they're supposed to study, the subject they're supposed to take in JAM. I don't know if I can just go ahead and then tell you the step by step of how
You have the floor.
you can come into radiography. Radiography is a serious course which you need physics, you need chemistry, you need biology, you need English for you to be able to come into radiography. So from your WAEC results, you must have at least 5 credits. And then take your JAM, have very high score, depending on the cutoff point for that year. And then you come in, and it's a 5-year course with a 1-year internship. So altogether we have 6 years before you do your, go for your youth service. And so when you come in there, there are courses that they are teaching you on radiology, radiation science, and some other courses. So the students come in from that year 1, and then you have professional exams. First professional exam in your year 3, and then your second professional exam in your year 5. And then when you are through with that, when you graduate, you are inducted into the profession where they are giving you the RRB and gives you a license, without which you cannot practice. So you need a license to practice, whether you are a clinical radiographer or an academic radiographer. Because we have clinical, I am an academic radiographer, and the people working in the hospitals are clinical radiographers. So without the license, you cannot practice. And then it's very lucrative because people finish and they go outside the country and they are paid well. Even here, we are trying in Nigeria, although it is well with the salary, but that's why everybody just jump out. They just go, when they finish, you tell them to come back here, they say, they are out there because they are paid very well, because the world is looking for radiography everywhere now because of these new technologies and because radiography is the eye of medicine. Without us, medicine is going to be very difficult. Before, people used to assume, okay, through symptoms, they just, okay, give you drugs. But now it's easier because they know exactly what is happening. So it's good for people to come in here. We need enough people, although the machines are very expensive. But I think it's getting better and sweeter for anyone that comes into the profession. They are coming up in Nigeria, and then we need people. We need people to stay back because the brain drain is really affecting us. Research showed that at least 4 radiographers leave this country every day. So you can imagine how many radiographers leave this place, and then they are really not hanging. Something coming up, and then there will be a lot of differences. Pediatric radiography, that's what we are thinking. We have different sections, radiotherapy, pediatric, gynecology. That's what I'm really thinking should happen because that's how medicine started. Now we have gynecologists and all that. So we start having geriatric, pediatric, and all that's what we are really thinking of to do in future.
Awesome. So I took 2 things from what you said, the sessions of radiography. We have the academic radiographers, we also have the clinical radiographers, and also it is also delving into the pediatric and different aspects of radiography. It is really impressive. So when, at least to you listening to us right now, you want to take this course, because many people have the perception that so far they see that word radio, they're like, I don't want to come and start talking or work in the radio and all of that. And because me, so I was like, radiography. Okay, let me go and do this course. And then I realized that no, it is not what you're thinking. It is something else. But since the radio is part of it, I ought to take that part. That we also have another aspect of radiography, which is the media. So please, you can come to the media part of radiography. Yes, if that's the part you want. But whatever it is, you had the, the things you have to do, the course you have to take, the subject you have to write in order for you to get this. And I think there are a lot of benefits because from what I could know, from what Dr. Ekaete said, there is internship. And then you're going to, from there you get a certificate and then you're able to practice. Come on, it's a very huge benefit. So if you're still battling with jam here and there, what are you waiting for? Come on, people are jackparing. We need people in this profession. Come and join the World Radiographers. Thank you so much, Doctor. So moving forward to you, Mr. Abeng, what partnerships or collaborations are in place to advance the profession at state and national level?
Okay, thank you so much. One thing is key. It is certain that you cannot be alone. I think a tree cannot make a forest. That is the ideology some people have. So we need to collaborate. It is what is called interprofessional collaboration. Where you are working in a center, in school, you need to collaborate. See, it is what you do that defines you and then give you network in you having a kind of relationship with others. Another thing we need to also emphasize is legislative advocacy is very, very key. You see, one of those points we also need to consider is this educational institution. Take for instance, the University of Calabar is here. They are training students, and these are products that we will be using both now and in the future. So, if you are in the clinical setup, like she has already said, there has to be a collaboration. I have talked about interprofessional collaboration, legislative collaboration, advocacy. Then, if you are working in a place, you need to collaborate. This is what defines you. You can't be in one place and people know you. Like I said, the world is dynamic. You need to collaborate with so many people to define yourself. That's what we need to do as radiographers too. Educational training is one of them, as well as I have mentioned. Without education, if you are in a particular place and you remain where you are, it doesn't give you. See, you need to also network. I heard one of the speakers say he's even having a kind of classes with other. Sometimes in the profession within himself, we network, workshop. These are things we need to hear about other professionals. Like for instance, let me draw attention. In most times, sometimes of course, is a conference is a yearly activity we embark, and we notice sometimes that in most of our conferences, we localize our activities within the profession. It's not a good idea because you need to share this idea to other professions. So this time around, we are taking the bull by the horn. We have the National ESCO has sat down and said, this is what we need to do. We need to invite other people from other professions to participate in our conferences. By this is a level of collaboration. People will hear us. We will definitely benefit from them as well as them benefiting from us. So we need to collaborate in this profession. Thank you.
Thank you. Collaboration and networking are the key things I picked out from what Mr. Abeng Oyama has just said. So please, as radiographers or in any field you find yourself in any profession, collaboration and networking are really vital skills to showcase yourself in that profession. Thank you so much, Mr. Oyama. Now let us move to the event proper. What should attendees expect at events today? This is to you, Senator Adason Leo Samuel.
Okay, thank you very much. So, like my chairman said, they are wonderful, wonderful things you should expect both from the parent association and from the student aspect. We'll be having a guest speaker today, a senior radiographer that will be giving and be talking, on a very, very wonderful topic. We also have, from the student aspect, we're having presentation also from the student aspect, a very, very wonderful topic. I want to encourage listeners out there to, by 12 p.m. today, put down to College of Health Tech, Dr. Annie's auditorium to listen more and have more insights on this wonderful topic. And I bet they won't regret coming.
So I also want to ask, is this event open to the public?
Yes.
Okay.
Yes, it's open to the public.
Understand. Okay, to you, Mr. Ephraim, are there any keynote speakers or special activities planned for the celebration?
We have theme person is going to be. We also have the committee director of PMP.
Okay, great. So, Dr. Ekaete, how can students and young professionals benefit from attending this event?
Information is growth. If you are not informed, they say you will be informed. So students coming there to hear, want to learn from the topic, and help them to grow in the profession and then love it. Most times when students come in their first year, I sit them down and tell them what to do and how to love the profession. And with that, be able to know what is in the course, and then you know which area you should concentrate and how to. So I believe when they come, they get informed, and then they grow. And because after a while, all of us will be, we need the young people to go into the profession and then do better. So when they hear, they can see what the profession is really, then they go by that. Our dream is that our people coming up to be better than us. That is what the world is. Shouldn't think that should be better than the number we fail. So when they come, they get informed, then we can do better.
Awesome. So yes, so you want to add something?
Actually, what definitely will come into play in my next
Question. Okay. So I got something that says if you are not informed, then you are deformed. That's like a word on marble. Please, in all you do, stay informed. Okay, to your next question, sir. How can or what message would you like to share with the public regarding the significance of World Radiography Day?
Wow, this is interesting. Today being the 8th day of November, a special day in radiography profession. Why is it significant? The significance of this day mark this birth, the birth of radiography into our profession. And you know, it is one of those things that radiographic indices or devices, radiographic advantages are derived into using it to actually make the healthcare profession so accurate. Now, what we are saying, what this day is so relevant, because it gives us the advantage of this radiography profession into treating this. When without the birth of this, we would not have had. We would not have had the the X radiation we are using today, because it comes in various ways. This helps us to treat a lot of diseases that the healthcare profession is benefiting now. So if this day is not celebrated, if this day is not being marked, it will not give us an information. The public will not know why we are celebrating.
Very true. Very true. Okay, there's just this one question I really want to get answers to, because I know that in everything we do, we actually face challenges. So what are those challenges that radiographers face, especially right here in Nigeria?
Wow. Okay, let me just itemize it. Limited resources. So, Ekaete mentioned low pay in most of our
Yeah.
so in most of our establishment is one of those challenges that definitely will not make any radiographer be in Nigeria. Secondly, the workforce is reducing. Now, if you go globally, recently 4,000 radiographers are feeding 271 million persons in this country. You can imagine the ratio. It's not, it cannot be equated in any way. You can't use 4,000 radiographers in this country. And so the workload, it brings out a kind of, burnout on the job you are doing. It brings about stress. And so, if this is happening in this country, it's something we need to rise up. About the Jabba syndrome we are talking about. Everybody wants to make it out there. And if the money is not enough, will you want to be in this country? So, inadequate training is one of those challenges we are facing out in this country. So, if we are adequately trained with the modalities on ground, sometimes in some centers you go there, you can't find any modalities to work with. But thank God, and let me use this opportunity to say that the University of Calabar Teaching Hospital is well equipped with almost all the modalities in place. That is one of those advantage we now have, and we give kudos to our present CMD, Professor Ephraim. So we are making sure that all the modalities are on ground. With this, we will have more radiographers to work with.
Thank you so much. Thank you so much, Mr. Abeng Oyama. And being that you're also part of the chairman of the Association of Radiographers of Nigeria, so I want to ask, how can people get involved, as to be a part of this association? How will the public, how can they do this?
Membership registration is key. For you to be a member in a particular place, you need to be registered. Now, to members as well, you need to be attending conferences. You need to participate in events like this. We don't see participating in events like this. We will take you as an unserious person, but we will advise you that for you to belong to an association is key. Of course, you need to also do what is called this CPD programs. Once you are involved in these CPD programs, will give you an edge. We would like you to pick and say, this is a resource person. Please be part of us. Advocacy is also key. We need to also enlighten our members on the advantage of belonging to an association. Because being alone, you can, if there are issues, you won't know the direction. You won't know how to actually handle this direction. So membership, advocacy is key. Membership registration is key. Also, attending to events like this. We are celebrating World Radiography Day, and you are participating with us. It's also a good step. Attending to conferences like this very month, from 19 to 23 of this very month, we're having our national conference.
Really, really awesome. And I hope you guys just like I did. To be sincere, I was saying, okay, let me be part of the Radiographers Association of Nigeria. Yes, it was really, really great having all of you right here. But before I let you go, please, I would love you to give a final word or a shout out to, the radiography community. So let me start with you, Dr. Ekaete.
Thank you very much. I just want to congratulate all of us for being radiographers and then remaining in Nigeria. Here, the Nigerians and then the ones in diaspora. Keep doing the good work. The work that are discouraged, just keep doing the good work. Something great is coming. I like to be positive, and I know that one day we will also let it go Japa into Nigeria. So thank you very much. Congratulations, everyone.
All right. Thank you. All right, to you, Ephraim Usani, please. What will your last words be? Your last words.
Okay. Happy World Radiography Day once again. It's an interesting profession to be in, especially for young folks like us, right? Because with technology taking over everything, this is where you want to be. And so for younger folks coming up too, you have not made a mistake. I remember then that everybody wanted to be a particular medical profession, but being in radiography is something you should gain, and the prospects are really amazing.
Okay, prospects are really amazing. All right, so please, Samuel, what will be your last words?
Thank you very much. So I would say congratulations to the radiographers all over the world, and speaking from the students aspect now, I would encourage us left correct in the profession to keep fighting hard, and there's always life at the end of the tunnel, and for those who are planning to enter the encourage them
Awesome, thank you. And lastly, Mr. Abeng, what will be your last words?
A big congratulations to all my radiographers out there. It is indeed a special day to our world celebrity. The theme for this world is promoting
Profession.
We should come out and promote our profession. Because if this day is not being marked, the public will not know what we are into. It is said, together we are strong. Let's come together and develop and enhance the healthcare profession, especially in the community we are finding, in Cross River State, especially where we have a Adobe, where we have a resident. Let's come together as a group of professionals and develop this and enhance healthcare wherever we are working. We can be in school, yes, or even in school, there are things you can, advise and lecture your students or the public concerning. We should have, in fact, we should always come together, have workshops, listen to these new modalities. They are all over in our platforms. In fact, one is ongoing right now. There is a kind of, visual a lecture going on concerning CT. So we need to advance ourselves in this. So if we come together as a group, we will grow higher and higher, and we will advance more, and we will promote this profession we are into. I say once again, together we are stronger.
Awesome. Together we are stronger. And I'll also add to that, congratulations once again to all the radiographers in the house, especially to the manager of Unico Radio 103.5. He's also a radiographer. So yes, congratulations to all the radiographers worldwide. We are saying awesome. You guys are amazing. And thank you so much for being the eye of medicine. Without you, I'm sure it wouldn't have been an easy work, but thank you so much for adding and contributing to our healthcare services. And also, my last word is that all I could pick from every conversation, I had so much collaboration and networking is key. Also, stay informed. If not, you are going to be deformed. I'm sure you do not want to be that way. This is still Unico Radio International, 103.5 FM. I remain your humble host, Michelle Edonset, and it has actually been a really wonderful time right here in the midst of these great minds and noble professionals. Yes, until we come your way again, I will say keep listening to 103.5 FM because we're bringing you back-to-back entertainment, education, and information 360. Don't forget to follow us on our social media platforms. On Facebook, we are Unico Radio International. On Instagram, we are Unico Rain. And Twitter, we are Unico Rain 1. I remain your humble host again, Michelle Idorset. So do have an amazing day. And thank God it is Friday. So go out there and enjoy yourself. Have an amazing weekend. Bye for now.